Dear friends, namaste to all of you. Today I'm going to talk about a very famous topic, that is cholesterol. A lot of patients, a lot of people around us, they are taking medicines to reduce cholesterol in their blood. So what is this cholesterol? We have to understand. What we can do ourselves to reduce this in our blood, we should understand that also. You see, cholesterol is a sort of fat, wax, that is being produced in our body. So if it's being produced in our body by the liver, it means it has got a specific job to do. So cholesterol we need in our body. That's why it's being produced by our body. And this has got a very important role in hormone secretion, to manufacture, to produce few hormones, steroids. And this is very, very important for every cell. The covering of the cell is being made with cholesterol type of fat. So cholesterol, what we are talking about today, that is lipoprotein. So lipoprotein, it means that the molecule of the fat, what is working together with part of protein. So lipoprotein is sort of molecule that has got fat and protein in it. So it's more than fat. You see, our body produces fat and we call that cholesterol. And this cholesterol, when it's more than it's required, then it's going to form a sort of plaque in the blood vessels and it's going to block your blood circulation. And so by narrowing the arteries, one can get heart diseases because heart is not going to get enough blood circulation. And that way, one can get heart diseases, heart attack, brain strokes, paralysis. So this type of risk one can have if his cholesterol is increased. So not only body produces this, but we, with our lifestyle and food habits, we can increase that. If we consume more fat, it can increase our cholesterol also. So body makes, but with our lifestyle also we can elevate that. So that is in our hands. So we can change our lifestyle and food. So we will be speaking on that. To treat any issue, we must understand that first. That's why it's important that people after 40, they should get their blood check done regularly to safeguard health of their heart. We should do our blood check regularly. So therefore, your doctor advises you to get your blood check done. That is lipid profile. So in this lipid profile, what they check total cholesterol. So total cholesterol, you have got a limit that it should not be more than 200. So this total lipids is, as the word says, total amount of LDL, VLDL and our HDL. LDL is low density lipoproteins, VLDL is very low density lipids, and HDL is high density lipids. So total sum of these three should not be more than 200. So if you see LDL, that is low density lipoprotein, so limit of that is 100 to 150. So that 100 to 150 and VLDL should not be more than 25. And HDL should be around 50. It should be more than 50. So if your patient has got this all three values in or around 200, then we say it's okay. Now, if a patient has got LDL 130 and his HDL is more than 50, then we don't have to worry about. So that's why we see that this cholesterol is dangerous for you and this amount of cholesterol is not dangerous for you. So we have to see that total. You see total amount of cholesterol, if it's more than 200 and your HDL, what is being considered as good cholesterol, is more than 50, then we say it's okay, don't have to worry about, because that HDL is being considered as good cholesterol and that will take care of that LDL. So that way we say our patient to take care of his food and lifestyle and he doesn't need that much medicines. And now if LDL is more than 130, 150, 140, something like that, and VLDL is also more, and HDL, the good cholesterol, is less than 50, let's say that is 40 or 30, then we know that good cholesterol is not that much and bad cholesterol is too high, then we have to take that in account and we advise our patient to take medicines. So that's the way we see patient to patient. So besides that, there is one more fat that is being checked in lipid profile, that is triglycerides. Triglyceride is very, very bad fat. Triglycerides, as the word says, tri, it's 3 molecule of fat with one glycerol, triglycerides. So that is then very, very bad cholesterol for our heart. So that is then very, very bad fat for our heart and we have to decrease it. So this triglycerides level is normal if it's in between 100 to 150. But if you have got a patient, if he has already problems with his heart, then we would like to have him under the level of 100. So how less triglyceride, how better it is. And so we see the level of VLDL. VLDL is very low density lipid. So that should also be not more than 20, 25. For a heart patient, it should be less than 20. So LDL, low density lipid. So what is being considered normal as 100 to 150, but by the heart patient, we would like to reduce it to the level of 80, 90. And so how low, how better for the patient it is. You see, if patient has got more cholesterol than it's required, he may not experience any symptoms. But you could be at significant risk of heart diseases, brain stroke, paralysis, heart attack. So you must get this check regularly. Once in a year, one should get his blood check done for these lipids, for this different type of fats what I have just mentioned. LDL, HDL, VLDL, triglycerides, things like that. So it's very, very important for the health of your heart. So it's indicator how healthy your heart is. So by a regular check of this lipid profile, once in a year, once in 6 months, it can tell you if health of your heart is improving or not. So in short, we can say that your HDL level, that is high density lipoproteins, that you should see that it's more than 50. And LDL level, low density lipids, it's normally ranges 100 to 130, 140. And if you are having problems with your heart, if you are at age, then you should make it lower than 100. Let's say 90 or 85 would be fine. And VLDL, you should not be having more than 20. And triglycerides, 100 to 140, 150 is normal range. And to keep your heart functioning optimal, you should bring that level low than 100 or around 100, let's say. So LDL, low density lipid, this is actually main source of making that blockage in the arteries. So it's very, very bad for the heart. And your HDL helps to get that blockage away from the arteries. So HDL is good cholesterol. And VLDL, very low density lipids, this is what develops more plaque in your arteries because it's very low density. It can penetrate and it can deposit in the blood vessels. So that's why it should not be more than 20. In short, we should manage with our lifestyle and food to increase the HDL and to decrease LDL. Since I have told you that cholesterol is sort of fat, and with the fat, you can increase this cholesterol. And the cholesterol is being found in animal products. Animal products like meat, like milk products, like dairy fat, like ghee, butter, cheese. So these all are full of cholesterol. And just opposite to that, our vegetable oils, that is without having cholesterol. So if someone is having problem with his heart, if he is having more cholesterol, then this is very, very clear that one should change his animal fat into the vegetable fats. The oils are being used. So then you have got good oils and bad oils. We will be speaking on that. But in any case, olive oil is very, very good. Mustard oil is good. Sunflower oil is good if it's not refined. So refined, we are not in favor of. Then one should give attention to alcohol. You see, alcohol, whiskey, beer, these are things, they decrease your HDL, high density lipid, what is good cholesterol. So if good cholesterol is less, then you have got more risk. So one should stop taking whiskey, alcohol, and beer. Not only that it decreases your HDL, but it's going to increase your triglycerides. They're very bad fat. So triglyceride is being increased and HDL is being decreased by consumption of alcohol every day. Once a while is okay, but it should not be quite often. And the other principle of food is that one should go for complete food. Complete food is that having all the ingredients, that one should be having carbo, one should be having proteins, fats, vitamins, minerals, water, and not to forget enough quantity of fibers. So we should take fiber-rich food. And exercise plays important role in that. So by exercise, we consume more reserve fats. So there is also after-burn effect. If you are doing heavy trainings in the sports school, that has got after-burn effect. That few days after doing that sport, your body will be consuming fat out of your reserves. So that way also you lower your cholesterol level. So doing exercise every day is very, very important, and once or twice a week doing heavy sport, that will give you extra boost to reduce your fat. So food plays important role. Your lifestyles play important role in maintaining the level of cholesterol. In lifestyle, again, I will say that early to bed, early to rise will make your cholesterol level the best. So this is combination of few tips that will help you to maintain your cholesterol level. And if it's really more than limits, then one should go to doctor and get his blood check done and take the prescribed medicine. So I hope with this information you can help yourself and you can keep yourself healthy. Thank you very much. Hope to see you again in my next lecture.